Now that we've explored the appearance and function of the heart, we're going to take a quick look at the cardiovascular system and the vessels that are connected to it. We're going to return to the cardiovascular system at the very end of this course after we've seen the organs and the other structures of the body so we can appreciate their vasculature in more detail. But it's going to be helpful to us going forward to get some idea about how the arteries and veins of the body are connected to the cardiovascular system. So I'm going to start very gently removing the lungs here. We can see the heart in situ. I'm going to take it out for just a second so that I can finagle these models of the lungs out of the way. Put the heart back in. I'm going to take its anterior surface off. So here, we'll zoom in. So here we can see the left ventricle. It's going to pump and send blood up the ascending aorta, then to the arch of the aorta. It's going to then turn inferiorly and travel through the thorax as the thoracic or descending aorta. The arch of the aorta gives off three important branches. The first one is this right brachiocephalic trunk, which is going to split into the right common carotid artery and the right subclavian artery. Likewise, these two vessels are doing the same thing, but they come off separately. So we have a left common carotid artery and a left subclavian artery heading towards the head and neck and upper limb, respectively. We're going to come back and explore these in detail in just a bit, but it's worth noting that here, the common carotid artery, as it goes superiorly in the neck, is going to split to become the internal and external carotid arteries. The external carotid artery gives off many branches to the neck and the face. We'll come back to that later. And the internal carotid artery is one of the major blood supplies to the brain. So while it has multiple blood supplies, one of the major ones is just here, and most of the vessels on this part of the cerebrum are going to be getting their blood from the internal carotid artery. We'll come back and look at the branches of the subclavian artery on a model that's designed especially for that. At the moment, let's take the heart out of the way and focus on the branches coming off the thoracic aorta. We have several intercostal arteries coming off of there. Those intercostals way up high come off branches of the subclavian, but down in the thorax, most of them, from here on down, are going to be branches directly off the thoracic aorta. Now at that point, the thoracic aorta is going to transition through the diaphragm. Now it's traveling alongside the esophagus here, so we're just going to remove that, maybe, and explore branches of the abdominal aorta. So after piercing the diaphragm, the aorta is going to enter the abdominal cavity. So we are going to remove all the abdominal organs. We'll come back and investigate those in subsequent lectures. And what we can see is at about the T12 level, the abdominal aorta exits through what's called the aortic hiatus here, and it's going to give off three midline branches that are going to the gut tube or the digestive tract. So we have our celiac trunk going to the foregut, our superior mesenteric artery going to the midgut, and our inferior mesenteric artery going to the hindgut. Now alongside that we have some paired branches. We have a left and right renal artery. There's also some branches that are not shown here going to the adrenal or suprarenal glands right here. Just here we have these very long vessels traveling down into the pelvis. These are the gonadal arteries, so either the testicular or ovarian arteries. And there are multiple lumbar segmental branches coming off at each level, and those are doing the same thing that the intercostals did, but in the abdomen we have no ribs, hence lumbar segmental arteries. And at this point, the abdominal aorta is going to split into a left and right common iliac artery. And I'm going to zoom in just a little bit there. And on each side, the common iliac artery is going to split into an external iliac and an internal iliac artery. Now the internal iliac artery is going to supply some of our lower limb muscles, but particularly it's going to supply our pelvic organs, which would be sitting in here. So pelvic organs, internal genitalia would be getting a lot of their blood supply from the internal iliac vessel, which is just going to be the one right here, whereas the external iliac artery is going to continue down through the abdominal wall and become supply to the lower limb. And we're going to talk more about that when we get to that section. We are now going to investigate the very large vessels that supply the upper limb. We have a model of the left upper limb here, so we're going to have most of that blood supply coming from the left subclavian artery coming off the arch of the aorta. The subclavian artery crosses out of the thorax, crosses the first rib, and we change its name to become the axillary artery. And the axillary artery is going to be present in this area, just here, and it'll give off many branches to the scapula, the proximal torso, or thorax, as well as the proximal humerus and upper limb. So this axillary artery is just here. We'll remove the deltoid muscle here, see a little bit more of where we're going. And as the axillary artery crosses this muscle, the teres major, it's going to change names yet again to become the brachial artery, or artery of the arm. Now the brachial artery is going to descend down here in conjunction with this long nerve. This is the median nerve coming off the brachial plexus, a little higher up here, but it's going to travel down the midline of the arm with the median nerve, and along the way it gives off several branches, but the biggest one is going to be an artery that goes into the posterior compartment of the arm with the triceps. That is called the deep brachial artery. And we can see some branches of it illustrated just here, but we can also see them on this side, and also catch a little bit of them coming down just around to the elbow. So the terminal branches of the deep brachial may make it down that far. At this point, we follow the brachial artery down to the cubital fossa, or the kind of crook of the arm, and we'll remove the musculature that's located here and see how it's going to branch from the brachial artery into two big vessels traveling all the way down the forearm to the hand. On the lateral side, we have the radial artery going towards the thumb, and we have the ulnar artery here traveling on the ulnar side towards the small finger, or digiti minimi, also known as the pinky. Now one thing to note here is that in addition to traveling distally, the ulnar artery is going to give off some branches that go right down the midline. This is called the anterior interosseous artery, and another branch pokes through the membrane between the radius and the ulna and becomes the posterior interosseous artery, supplying blood to structures on the deep posterior side of the forearm. Now once the radial and ulnar arteries have made it into the hand, they create two different arterial arches. The ulnar artery typically gives most of its blood to the superficial palmar arch, but it also contributes a little bit to a deep palmar arch. But the deep palmar arch tends to get more of its blood from the radial artery, which is going to cross through this area here, dive between these muscles, and then come out on this side to contribute mostly to the deep palmar arch. And all along the way, we're going to have a variety of digital arteries traveling towards the fingers. We're not going to worry about the individual names right now, but just note that off these arches we have digital arteries that are going out onto the fingers to actually supply blood all the way out there. To look at the vessels of the lower limb, we're actually going to start with this massive model, go up to the pelvis and see where these arteries originate, and then follow them down distally towards the thigh, the leg, and the foot. So here in the pelvis we can see the common iliac artery splitting off into the internal and external iliac arteries. Now the internal iliac artery is supplying the pelvic organs. It's also giving off an obturator artery here heading towards the medial side of the thigh, and a superior and inferior gluteal artery that are actually going to supply the gluteal muscles. The rest of the blood here in the external iliac artery is going to pass through the inguinal ligament, and then once it enters the thigh, it is called the femoral artery. You can see it running along with the femoral vein right there and the femoral nerve. So I removed the sartorius muscle here. And don't worry, we'll come back and look at the muscles in detail a little bit later. And we can see that the femoral artery continues inferiorly in the anterior portion of the thigh until it punctures the adductor muscle, or adductor magnus muscle here through the adductor canal. Now, as it's doing this, it also gives off branches that are going to the head of the femur. We have a medial and lateral circumflex femoral artery there. And before we go any further inferior, I just want to flip the model so we can see on this side those gluteal arteries I mentioned before in just a little more detail. So here we have superior and inferior gluteal arteries, and they're exiting on either side of this muscle, which is called the piriformis. But again, superior and inferior gluteal arteries supplying blood to the gluteal area there. But the rest of the lower limb is getting its blood supply from this vessel. This is our femoral artery. Before it passes into the adductor canal, it gives off a deep femoral artery, which is traveling in the medial compartment, but is actually going to puncture and have multiple branches going into the posterior compartment of the thigh, and that's where our hamstring muscles are. So here, to make things a little clearer, I'm going to get rid of these other muscles, including our hamstring muscles here. And they're not showing much, but there would be some perforating branches coming from the deep femoral artery into the posterior thigh. Now, as the femoral artery passes through the adductor magnus muscle, it exits on the posterior side of the knee through this adductor hiatus. And at that point, it magically changes its name to become the popliteal artery in the hollow part of our knee. Now I'm going to take off some of our calf muscles here so we can see that vessel a little further. And the popliteal artery continues down across the posterior aspect of the knee, gives off several genicular branches that surround the knee and perform, give blood supply, but also provide an anastomosis with each other through there. And as we travel into the posterior leg, the popliteal artery ceases to be as it gives off an anterior tibial artery. Now that anterior tibial artery is actually going to pierce the membrane between the tibia and the fibula, and we can't really see that here. So I'm going to flip over onto the anterior side of the leg, and in this anterior compartment of the leg we can see the anterior tibial artery is just here, and if we follow it down, that vessel, the anterior tibial artery, is going to cross into the foot. It's going to cross the talus and become the dorsalis pedis artery, or the artery on the dorsal side of the foot. So there, it's going to travel down, give off some branches to the digits, but it's also going to have an artery that dives deep between the first and second metatarsals to go to the sole of the foot. And to catch up with that, let's flip back over here and look at what's on the posterior leg once more. We have the posterior tibial artery heading down. It gives off a fibular artery that we don't see in this model, but it would be coming off this way. It's fairly large. And then that posterior tibial artery is going to pass the medial malleolus on the medial side of the foot to get to the sole of the foot. Once we're here on the sole of the foot, we're going to remove this portion of the musculature, and we can see that the posterior tibial artery is going to branch into a medial plantar artery, and here a lateral plantar artery. So this lateral plantar artery also gives off an arcuate artery here that kind of loops across this way, gives off several digital branches as well, but this deep artery from the dorsalis pedis on the opposite side, the deep plantar artery, meets up with the plantar arch here and provides some collateral blood supply if needed.